What I want people to know about cervical cancer as a GYN oncologist is that this is a very common disease. Across the world, cervical cancer is the second most common cancer diagnosed in women. What's also important to know about cervical cancer is that it's highly preventable with a safe vaccine called HPV vaccination. One thing that patients can do is to have regular screening with the pap smear. When we do a regular screening for pap smears, we are looking for precancerous lesions of the cervix that we can then treat before they become a cervical cancer. The other way to prevent cervical cancer is by receiving a vaccine. This vaccine covers for 9 different types of the HPV virus, 7 of which are associated with about 95% of cervical cancers in the United States. HPV vaccination is a highly effective and safe tool for the majority of people to receive for cancer prevention. As a GYN oncologist, I'm highly motivated to get my patients and their children vaccinated against HPV because it prevents cancers that I see regularly, like cervical cancer, vaginal cancers, vulvar cancers. In men, a common cancer diagnosis from HPV is oropharyngeal cancer, and the HPV vaccine prevents against this too. HPV vaccine is recommended starting at age 9 and then up through age 26. For some individuals, up to age 45 is even indicated. This is just shared decision making with you and your provider on what's best for you as far as cancer prevention. I think it's always important for women to be aware of their bodies, and when we think about cervical cancer, some of the signs or symptoms that we worry about are bleeding that's out of normal for that patient, for that female. If she's having bleeding in between her cycles, if her cycles have suddenly become significantly heavier, pelvic pain can be a sign, or abnormal vaginal discharge can also be a sign that's worrisome. This disease, while highly treatable and preventable, can have devastating effects, and it's often a disease of the young. And so it's hard for young mothers, young women, mothers to look at their children having to go through these things. And when we think about this is a cancer that can be prevented by vaccination and also picked up by early screening with regular pap smears, I want patients to be aware of these things and get their treatments.